Breast cancer took my hair and chest, but not my seat at Arrowhead.
We take a look back at this viral moment. So where is she now, 10 years later? Coming up, her cancer is gone, but her new battle, getting her body back. And good morning. It is Friday. It is Red Friday, January 27th. I'm Jessica Lovell. Welcome to the Morning Medical Update and to the Dulcie Simons Jr. Family Broadcast Studio. Red Friday as the Chiefs are ready to take on the AFC Championship game just 2 days away from now. So no better time to catch up with a super fan who refused to let anything, not even cancer, stop her from cheering on her favorites, the Chiefs. So make sure you get your questions sent in to us on YouTube, Facebook, and the Medical News Network. You can find links to all of those right there on your screen. A Kansas City woman became a symbol in the fight against breast cancer. Stephanie Reynolds refused to let her diagnosis stop her from the thing that she loves to do most, which is be in the stands at Arrowhead. But now Alexis Del Cid talks with Stephanie as she faces yet another battle.
It's been a decade since this now iconic photo of breast cancer warrior Stephanie Reynolds was taken at Arrowhead Stadium.
Oh, Arrowhead. Arrowhead's such a great place.
She just had a double mastectomy and lost all her hair, but in true Stephanie form, she wasn't about to miss watching the Chiefs beat the Raiders.
Breast cancer took my hair and chest, but not my seat at Arrowhead.
Did you ever dream that the next day you would wake up to that being on the front page?
No.
10 years and many tattoos later,
I love tattoos. I think tattoos are art.
the cancer's gone, but she's still fighting the battle to get her body back.
How long has the Reconstruction battle been going on?
10 years. Since day one.
She says her body rejected the implants she first got at another hospital years ago, and procedures since then have come with other complications.
My right side is way bigger than the left side.
Which is why she's here at the University of Kansas Health System for an appointment with plastic surgeon Dr. Julie Holding. Her goal, to feel like herself again when she looks in the mirror.
I literally sit there for 20 minutes just trying to make sure that before I walk out the house that I don't look like this breast is, taking up my whole side. Mentally, I can't live with this.
But she did live with it for a very long time, reluctant to ask for more after surviving cancer. Unfortunately, Dr. Holding says that's common.
Women kind of feel embarrassed, or they feel like they're being vain for asking for this, but I always tell them that this isn't a cosmetic procedure. They had a part of their body traumatically amputated. So wanting to reconstruct an amputated body part is really important for somebody's emotional and physical well-being.
And Stephanie's now in a new place today, filled with hope.
So how far do you go to make yourself feel like a woman? However far you need to. If you want to, then do it, because nobody's living your life but you. And that took me a long time to figure out for myself too.
Such a powerful message. Stephanie is joining us now this morning, along with her plastic surgeon, Dr. Julie Holding. Good morning, both of you ladies. How are you?
Good.
Good. Stephanie, good to see you.
Thank you.
Well, so take us back 10 years. Stephanie, what did you make of all the support that came from that one picture?
I think it was more day to day back then. Looking back on it now, I do not walk into Arrowhead without thinking about this sign. So it's overwhelming. I saw people stop me on the street. They're like, "Oh, is that you?" And yes, it's me. People call me. Friends that have friends recently diagnosed with breast cancer reach out. I go sit and talk with people. So, yeah, it's changed my outlook.
Well, that's what I was going to ask you, is how it's helped you work through your cancer journey.
Definitely for the better. And I definitely live a different life than I did 10 years ago. So I buy the shoes, I eat the cake, I take the trips, I just do the things in life that people take for granted.
What's the status of your cancer now, Stephanie?
Complete remission. So, yep. Cancer, part of it is gone. Blood work's good. So I just working on the reconstruction part of it.
Well, let's talk about that. And you said, I beat cancer and I didn't want to ask for more. But as we're going to hear from Dr. Holding here in just a moment, this is all part of it. It doesn't really end until you're back to where and who you want to be and how you feel good about your body. So take us back to when you were diagnosed, and then that was just kind of half the battle.
Yeah, so being diagnosed, I think, as a woman, losing your chest is part of it. You know, you think when you get done, you're going to be cancer-free, you're going to have this perfect little, cute little body, and life's going to go on because you believe in your doctor that it's cured, you're great, and it's not so much that the belief isn't there, it's the fact that your body just can't, they just don't accept the forms that are being given to you. So you just keep trying, to me, being able to be comfortable in my own body is more important than people telling me, oh my God, you're having another surgery. You know what? Yes, I am. And it's me, it's my body. So.
Dr. Holding, is this pretty typical? Talk to me a little bit about what those conversations are like. And every woman's different on where they're trying to go and what they're trying to achieve post-cancer. But talk us through a little bit what these conversations are about.
It definitely is dependent on which stage of cancer treatments they're at when I see them. In the beginning, when they were just diagnosed, at that point, a lot of times women are in more of a survival mode. So they just kind of want to, their thought is, I want to do one and done. I just want to finish and just get my cancer taken care of and move on with my life. And, it's very challenging to, just kind of say, okay, let's just take a breath. I know this cancer is not your choice, but this is something where you do have a choice. You can, take it one step at a time, and I say it's more of like a process of building, right? Because anytime you make something, you're building, you're reconstructing, it's a journey. And so trying to tell patients that, realistically, you're gonna have more than just one surgery, and, try to take a breath and just look at it one step at a time. The only thing that you need to decide, say in that pre-conversation before mastectomies, is do you want to start reconstruction at the time of your mastectomies or don't you? And there's no right or wrong answer to that. It's really just where they're at. Some women don't want to deal with, the risks associated with reconstruction. They wanted to get through the cancer, and that's fine. Other people will say, yes, I just want to get it started, let's go. And so then we talk about, the different options for reconstruction and what that first stage can entail.
And you're right, they're in such a different emotional state, because you're right, you're in such an emotional place of survival. And so having that conversation can feel like a million miles away about breast reconstruction. But that's something you do talk about early on. I know we've talked about this in the past, is that is a conversation. It starts, when the cancer diagnosis, the mastectomies are discussed. Explain why that is and why that makes a difference on the result down the road.
A lot of patient satisfaction is really about education. So understanding that, the options that are available, the risks and benefits with all of it, and knowing that they don't have to do anything, but if they do, there are options for them to help. I even have some patients who don't want breast reconstruction, but because they have some side effects from the cancer treatments, whether it be radiation or just the mastectomies and tightness, or what they don't like, I can help them with that as well. But it's really more about trying to just set up a realistic expectation that we've got a foundation that we have to establish, and then once we get there, we can build upon it, kind of in the revision reconstruction phases, meaning kind of nipping, tucking, lifting, making things more symmetric, bigger, smaller, whatever they, would like to do.
Whatever they want, they get to have. So let's talk about where Stephanie is in her process, and then I want to talk about some of the options.
So she came to me after she had already had reconstruction, and so that was also another, a nice place to talk with somebody, because they've already kind of had that foundation, like I said. So foundation, when I consider it, is like, building a house, implants or using your own tissue, and she was having problems with those implants. And so we kind of had to step back to say, okay, well, do we want to move forward with what you have, or do we want to kind of start over with that foundation? So she had, a flap surgery, and then now, we're talking, the next step. What do you think about your results now? How is it affecting your life? How are you fitting in clothing? Is there something that we can do to fine tune things to make things a little bit more livable?
You mentioned the flap surgery. Explain what deep flap options are.
So using your own tissue, so kind of the general broad scope of reconstruction is, implants versus using your own tissue, or what's called autologous reconstruction. And what essentially it is taking that tissue that you remove, say, in a tummy tuck, even though it's not a tummy tuck, and utilizing that skin and the fat from the abdomen, and then transplanting it to the chest. So you essentially use your own skin and fat to start the reconstructive process. It's called a deep flap. Sounds like DEEP, but it's actually DIEP.
And we talk about tissues expansion. That's what you would use if you're going to have an actual implant. So that's one of the first stages as well, right?
Correct. So one of the first conversations would be, do you want to start reconstruction at the time of your mastectomies or not? Kind of that situation. And if patients don't have to decide one way or the other at that first surgery, if they want to do implants or if they want to do like their own tissue reconstruction. And one way to do that is, say, use a tissue expander. So a tissue expander is a temporary type of device that is meant to push on your skin, stretch it out to give you a little bit more shape, so you can utilize, your own skin on your chest. And sort of as a space saver while, say some people are going through chemotherapy or radiation therapy, or while they're just trying to recover from surgery itself, while they decide what they really would like to do.
So then they start to make choices. Help us understand the difference between silicone and saline implants, and why one would be right for someone and not another.
I always tell them that, saline and silicone, it's really, people say, well, what do you recommend? And I say, well, this is the pluses and the minuses, what you feel safest with, what helps you sleep best at night. That's kind of what to do. So the saline or the silicone implants, we'll start there. They have been modified over time, and the one that's in the right on the picture is something called a cohesive gel. So it's more like a sticky type of jello. And then the one on the left, we don't use that textured type of device anymore, but it's at least showing you that it's what we call the gummy bear implant. It's the most cohesive, and so it's more like if you cut a gummy bear in half, it maintains more shape and form. And so, the pluses and minuses with those would be, one maintains more form. So if, you're wanting to have more of a rounded reconstruction, that may give you a little bit more of that kind of shape. The downsides are that, anytime you have a foreign object in your body, from a splinter to an implant, you form scar tissue around it called a capsule. And with time, that can get thicker, harder, kind of contract. And then sometimes even become, asymmetric or uncomfortable. And so with silicone, sometimes that happens a little faster, whereas saline, it comes empty, and it, I fill it from an IV bag straight into the implant, and fill up with specific volume, whatever we have talked about before. And it is less reactive with the body, so it tends to have a little bit thinner scar tissue. It doesn't feel as natural as silicone, though, so that's a lot of times why people choose silicone. And then, if something were to happen, say the outside of the bag were to rupture, saline would just go flat and your body would absorb the salt water, the saline. With silicone, you really don't know. It's, silent, and so that scar tissue contracture can happen, earlier.
Okay, so you go through all of that and then help them make the best decision for them. And see, I was thinking the opposite. I was thinking silicone would be more natural.
It feels more natural.
Feels natural, okay.
Feels more natural, but your body has a little bit more reactivity with it.
Gotcha.
So.
Okay, so Stephanie, I want to bring you back in here, and we heard a little bit from the story that you did with Alexis. I want to know, tell us about your reconstruction journey and what you were not happy about after that first reconstructive surgery that you had.
Well, so after the first one, I felt, of course, I had chemo and radiation. So, of course, the right side of the skin is different than the left side of my body, the skin type. So, it like one side was firmer and higher, the other one was lower. It felt like it had dropped a little bit. It kind of was underneath my armpit. And so when I first went to Dr. Julie Holding, we had, which I was trying to remember when I went there, it was before grandkids and before kids, so it's been a minute. But we tried to, the first time, tried to even it out so that it at least appeared to be the same size on the outside. So I believe that it was, we'd redone the left side to make it try and match the right side. We did some fat grafting, we did some other implant types, and then went with the deep flap in 2017, which has actually been the best. I feel better physically. I feel better. However, now I gained some weight. The right side is probably, at least to me, it feels like it's 20 times bigger than the left side, but it's really not. It's probably, I would say it's at least double the size of the left side. So it makes it really, really hard to get dressed. I know people don't think about that because on the outside we can mask things, right? But when you're on the inside and I'm walking around, I feel like people just stare at my chest because I'm not comfortable with it myself. So this upcoming surgery, we will even out the sizes, do a little lift, and hopefully, you know what? I'll live happily ever after with 2 symmetrical chests. So
that's not much to ask for, right? I don't think so. Well, and I want to talk about the vanity part of it. And Dr. Holding, you're the first to say this is not about vanity. You said you've had a part of your body taken away from you, and talk a little bit about that and your message to women who are concerned about what other people might think.
Yeah, I do hear quite a bit with patients. You know, my family thinks I'm crazy for wanting to do this. You know, family members will ask me, well, is this the last one? Some people are even saying, you know, I'm a teacher, I work with children, and they're not very forgiving. So, you know, I want to just be able to go to work and, you know, focus on my job. You know, breast reconstruction is an option when patients, you know, like, you don't have a choice. I mean, it's not like somebody chose cancer. So with cancer, you have just some very limited options to treat the cancer, and a lot of times you're just having to go through the steps of what people tell you, like, okay, you're going to have surgery, or you're going to do chemo, you'll have surgery, you'll have radiation, whatever the case may be. And so patients are just kind of following along and kind of in that survival mode like we talked about. With reconstruction, it helps you. I mean, the things that people don't think about, they think, oh, it's just breast, you know, it's just, you know, who cares about breasts? And I mean, women, I mean, it's part of you. It's a part of your body. And, you know, you have to have it traumatically altered, taken away. Some people even say deformed, you know. And there's also things that come along with, you know, even just the mastectomy itself. I mean, scar tissue. Mm-hmm. Scar tissue can be very uncomfortable. Radiation permanently changes the skin. I have so many conversations with women about how once you've had radiation, the skin and the tissues that have been radiated are now more like scar. I call it the iron bra. It doesn't really stretch as well. It doesn't tolerate, you know, implants like Stephanie. It can be very uncomfortable, contract, you know. No matter who does the reconstruction, the body will be very unpredictable. And so you have to kind of fight those changes after mastectomy and radiation in order to try to achieve something that, number one, feels comfortable. You know, I mean, my goal too is to also help with some of those negative side effects of radiation. And a lot of times using your own tissue, and I would say majority of the times using your own tissue is really one of the best ways to do it with radiation, because it helps heal some of the negative side effects and it isn't a foreign object. And that's exactly what we saw with Stephanie. And a lot of patients who are in that same situation as her, which there are a lot, say, I can't believe that I didn't do this sooner. It's so much more comfortable.
Yeah, especially since the options have changed. My story is my best friend and I go round and round. Her mother's 75 years old, had breast cancer, and keeps getting surgery to make it right. And she's like, my mother wants another surgery. It's driving me crazy. And I said, she goes, nobody's even looking at them anymore. And I said, she's looking at them.
Yes.
She looks at them every single day. I said, let your mother get the surgery as long as it's done safely, right? Yeah. It's just, everybody's different. It's about you.
Yeah, and it's, she's still alive. I have patients who, come in and see me and say, am I too old for this? And honestly, as I get older, they're like more my age saying that, and I'm like, of course you're not. But the oldest woman I've had was, she was in her 80s, and as long as you're safe medically to have surgery, and you understand the risks of the surgery as well as the limitations. This is not a breast augmentation. This is not a tummy tuck. This is about restoring form and your comfort levels. And so, if somebody is nitpicking and saying, this is like a little, millimeter difference, I'll be like, well, if we do this, the risks are you're going to have a scar in that position. Is the scar going to bother you more than what's going on right now? So, there are limits. It's not like, we forever are having surgery, but it's just, sometimes there are more challenges with one person as opposed to another. And again, radiation is definitely one of the ones that causes the most challenges.
We're going to put a QR code up on your screen right now. You can scan it and find more information about breast reconstruction options here at the health system. Just quickly, what's next for Stephanie?
So this is, again, like she's already had sort of that foundation, and so we're doing some fine tuning. The body, again, she has fat, as her reconstruction, and so she mentioned she gained weight. That'll make the breast reconstruction get bigger, more like fat. It's not like a breast would change with, weight changes, as it changes more. So, we see that it's kind of exaggerated some of the differences between her two sides. And again, some of that radiation is causing, the right side to have a different shape and a little bit wider. So we're going to go in and essentially, take out some of the tissue, it's not a lift like a regular breast lift, but it's, kind of lifting, shaping, trying to get things to match a little bit more tolerable of a size, those kind of things.
Stephanie, so 10 years ago, you got to be a Chiefs pink seat honoree, is that correct?
I did.
Do I dare ask you how excited you are, or how excited you've been over the last several seasons? But sitting here on this Red Friday, talk to us just about the kind of Chiefs fan you've grown into be.
Oh, God. Okay, so I just want to say real quick, too. So I was born at the halftime of the Chiefs-Redskin game in 1969. So 12/21/69. My dad never missed a play. So I was pretty much born like right into Chiefs season. I've been a diehard fan since then. Of course, growing up, we now have family parties. All the cousins get together. It's awesome. It's so much fun. And watching them win, Super Bowl, yet alone, back-to-back, three-peat, taking my kids to that game was the first time I have ever been able to take all three kids. So it was a lot of fun. We took a lot of family pictures. And so, I believe that we got a three-peat. Let's do this.
Let's do it again. You're the lucky charm. I think you're it. So keep it going. Okay, hang tight. Let's check in with Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control, joining us on this Red Friday. Good morning to you. How are you?
Yeah, good.
Good to see you.
Yeah, good to be here. So right now in the hospital, we have 20 active infections, which again, we've seen our numbers decrease as far as active infections go, which is a good thing. Of those 20 active, 4 in the ICU, and 4 of those are on the ventilator. A total of 47, but the 20 active is good news. Hopefully we can keep seeing less and less COVID-19 in the hospital.
So, Doc Hawk, a committee of advisors to the FDA voted unanimously yesterday on a proposal to simplify the nation's strategy for vaccinating people against COVID-19. What did they decide?
Yeah, so they're going to decide. I think that's the key, is to simplify it. Maybe putting it in the fall ahead of the influenza season, so you can get both of those at once. We know that there has been concern because of confusion about the vaccine itself. How many do I need? When do I get it? So I think they are looking to really simplify it, and that's the key here. But simplify it because we know it can protect. The latest amount of data, there were a couple articles in the CDC's MMWR as well as the New England Journal of Medicine this week that did show the benefits of the bivalent boosters, even benefits over the monovalent boosters as far as giving a little bit more protection, at least in the short term, against even infection. This did include also the XBB variant, but also, of course, hospitalization and severe disease. And that is the main goal of the vaccine, is to build up that immunity, protects you from hospitalization and severe disease, and of course, death. And the earliest data right now does show that beneficial effect. So.
And new studies show updated bivalent boosters are cutting the risk of getting sick from COVID-19 by about half. So what does that mean for someone who got the original vaccines but has not yet gotten the bivalent booster?
Yeah, again, this just continues to support the fact that being up to date, and what we call it now is just being up to date with your recommended vaccine dose, that the bivalent boosters are working to even a little bit reduce that chance of infection, reduce that symptomatic infection as well. Again, early data, likely that potential to reduce the chance of symptomatic infection is probably going to decrease, but we know that overall protection against hospitalization, severe disease continues to be strong, even though there does tend to be a waning there as well. But I think it just, again, continues to reinforce the data is good. The vaccines are safe, but the data also continues to support the fact that they do help protect against, sometimes, in some instances, against infection, but most importantly against that severe disease and hospitalization as well. So it's all, really good news. We're going to look to continue to see what the final recommendations will be moving in through the spring. We know that we are still collecting data from this bivalent booster period, and so when that does become available and the analysis and the results, we'll kind of let you guys know as well. I know you will. Doc Hawk, thanks so much. Any reporters on the line today? Let's get to some good community questions, shall we? Jill wants to know, is this covered by insurance, reconstruction surgery? So the federal government created the Women's Health and Cancer Act, which states that women, it's federally mandated that insurance companies cover the reconstructive process after mastectomy, and also the full thing, like all stages of reconstruction, as well as any complications and symmetry procedures on the other side to match. So say somebody had a one-sided mastectomy, normal breasts on the other side, it says that they need to cover the symmetry on the other side to help things match. Doesn't mean that insurance companies make it easy. That's worth noting. If a woman opts for implants, how long do they last? Will you have to replace them over the years? So there's really, if you ask, no matter what surgeon you ask, they will all have a different answer because there is no set timeline. The manufacturers used to only guarantee, at least the major manufacturers used to only guarantee the outer shell of the implant for 10 years. And so we would just kind of say, well, maybe every 10 years get it done, because then that way, if something were to happen, it would be covered by the manufacturer. Now, a lot of them will cover, the main ones will cover lifetime. And so really I say, the new guidelines for recommended to evaluate silicone implants is to get an ultrasound at 5 years after you have them to see if there's any issue with the actual implant.
And then every 2 to 3 years after, you can get an ultrasound again to take a look at it. They said also MRI, but I think, ultrasound is definitely acceptable and a lot easier for women. So unless you have a problem issue, then I would say that as long as you monitor them, then you can keep them for quite a while.
Stephanie, a lot of emotions come from the minute you're diagnosed through the entire reconstruction process. But Delaney wants to know how you handled the emotions of losing your hair.
Oh, so funny thing. So I'm a hairdresser by trade. I now have a different job, but I still do hair. Losing the hair, it was intense. You go to chemo one day, I had a full head of hair. I went home that night and my doctor did tell me, you'll lose it after the second treatment. No, you're gonna say, no, I still got it, I still got it. I got home that night, I scratched my head and handfuls came out. That's hard. It's even harder when it comes back and it's not quite the same. I don't have the same hair texture. It doesn't grow in quite the same. It's a little different, but you just get through it. I think I felt so terrible that losing my hair through chemo, you just kind of expected it. So you just try and make the positive.
So on that note, Talia wants to know if you have any advice for someone who may have just been diagnosed with cancer. What would you tell them?
I literally just got a phone call 2 weeks ago that one of my very best friends was diagnosed, and she said, what do I do? And I said, well, whatever you want to do. Make sure you ask questions. Make sure you get a support system that's there. Find your one comrade that's going to be like, whatever you want to do, I got your back. Opinions, you want to cry, you want to scream, you want to hit something, find your Weezer. That was kind of my joke. Luckily for me, I have an amazing sister. She used to get calls in the middle of the night, to have your one person that you can talk to, about anything, oh my God, my right chest hurts so bad I can't move my right arm, or, there's all sorts of complications that come along with not just breast augmentation or breast reconstruction or anything like that. It's side effects of, pretty much anything on your internal inside. So, just do what you can to feel better. Take it day by day. You're going to have great days. You're going to have bad days. That was the reason behind my sign, was that, no, I'm not a season ticket holder. I love the Chiefs, but it just never was in the financial budget for me to have season tickets. But the days I felt good going through cancer, I bought a ticket. I went to the game. And that was the purpose behind my sign. Today was a good day. Today was such a great day. I got to do what I love to do. And that alone made me feel better.
I love that. And you do not need season tickets to prove what a Chiefs fan you are, by the way. I think you have done it. You have done it. You've lived it. Since your whole life, since you were born at halftime. I want to get final thoughts from our guests. And Stephanie, I am going to start with you, and such a great, powerful message. But anything else that I haven't asked you, or anything else that you want to share with our viewers before we go?
I really, for anybody, one thing I wanted to kind of share with people that I don't think they understand is that, surgery is big. Surgery to make yourself mentally, physically better is huge. And if you know somebody out there that's fighting these challenges, that are wondering, I hate my chest. I don't ever want to wear a swimsuit. I don't want to go out in public in a tank top. I won't wear that because my breast cancer scars. Be supportive. Not only if it's you, be supportive, but if it's your mom, if it's your aunt, if it's your best friend, if it's whoever it is, they have enough challenges going on that they really don't need somebody saying, oh my God, another one, or the fact that, oh, I think you look great the way you are. I wouldn't do it if it was me. Well, that's great. You know what? Good for you. I'm glad that you're so happy and you're so, I'm not. And for me to get my brain back to being a successful, independent, woman that has survived breast cancer, I'm doing this for me. So I just want the support. And I'm pretty sure that they do too. So be supportive, find a positive, and help them out. Just a word of encouragement is all it takes. We believe you, we understand, we get you. That and verbalize it. Don't just sit there and say, I'm going to take you out to dinner. I'm so sorry you're going through breast cancer, and let's get together soon. And follow through. They just need you to be there.
Stephanie, thank you so much for your words. You're an inspiration. Thank you for holding that sign high for everyone to see. We appreciate you very much.
Absolutely.
Dr. Holding, your final thoughts today. Great gal.
I know. I can't emphasize enough what she just said about, having support. And, I do hear a lot of patient families or patients telling me their families are just like, don't do it. You've been through enough. And really, honestly, like, Stephanie was saying, just validate them. Don't try to, minimize what they're going through by saying, well, just look at the bright side. You don't have cancer anymore. And, for some women, that's enough. Mm-hmm. And that's fine, But if somebody's having a challenging time from any of it, just be there and really mean it and ask them, what can I do? Is there anything I can do to help? And sometimes a hug is good. Just be genuine and real. And I would always say, just take it one step at a time,
Dr. Holding, always great to have you. Thanks for all the great work you do.
Thank you.
Dr. Hawkinson, final thoughts today.
Yeah, I would second that too. For so many people out there battling cancer, it's so important to have a good support system and a great medical team that you can work with and have those questions answered. And on the topic of COVID-19, it's also important to continue to remember to be up to date with your vaccination. We know that the virus is circulating still at high levels, but it is getting better. Hospitalizations are down, but do the most to protect yourself and your loved ones. Be up to date with your booster, and continue. If you have questions, please talk with your medical team, your physicians, to help get those questions answered in an honest way.
Doc Hawk, thanks so much, and thank all of you for being with us today. We will be cheering with all of you for the Kansas City Chiefs taking on the Bengals this weekend. And as we go, we want to share some special Chiefs moments with you here at the health system. We were very fortunate to have a visit from 3 Chiefs ambassadors. They spent a lot of time with our patients, signing autographs and taking pics with those fans. And the 3 ambassadors there, Chris Penn, Tim Barnett, both wide receivers from the 90s, and former Chiefs defensive end Eric Hicks, they spent several hours at our place making the day for so many here. And for that, we say a sincere thank you to all 3 of them. And from everyone here at the health system, go Chiefs and have a great weekend. Coming up Monday on the Morning Medical Update. Imagine having cancer as a child, then having to get all new doctors as an adult. I'm Jessica Lovell. Coming up on the next Morning Medical Update. Coming of age changed everything for patient Alex Dinkle. Meet him Monday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stein's podcasts. Now, everywhere podcasts are available.